Hi there, and good afternoon. Welcome to Canceling COVID. I'm Tanya Rivens, and we appreciate you joining us on this Friday as we continue to work towards canceling COVID, this pandemic that has been so relentless in attacking us. We've been relentless in dealing with this pandemic. We are here for real talk, real resources, and of course, we are here to serve you as far as the community, getting to know the information, getting to know the facts. I want to say thank you to our sponsors, Mecklenburg County Public Health. That's mecnc.gov, mecnc.gov, and Groundwater Solutions. We're so appreciative of all that you have done. Again, I say this every time. We launched in January, and we're still here in November answering your questions. And speaking of November, of course, we're headed into the holiday. We're headed into the colder months. We're headed inside, folks, and that means we cannot drop our guard. So we've got a very special guest is joining us today. If you have any questions, you are encouraged to call Mecklenburg County Public Health or reach out to Groundwater Solutions. But a very special guest that's getting ready to start us today to join us. Her name is Angela Dunston, and she is with the North Carolina Community Action Association. And they have put in some work to talk about how COVID has impacted our community, and I'm looking forward to her sharing this information. So good afternoon, Angela. Thank you for joining us.
Good afternoon, Tanya. Thank you so much for having me on your show and for me being able to share some information with your listeners about a recent COVID impact report that our association produced.
So I can't wait to get into this. So let's start by talking about what is the North Carolina Community Action Association, and tell us where you fit in with this organization.
So the North Carolina Community Action Association is comprised of a statewide network of more than 34 nonprofits that cover every region of North Carolina. The association started in 1964 during the Civil Rights era, and for more than 50 years, Tanya, the association has worked to ensure that low-income and vulnerable individuals and households that are below the federal poverty level have access to resources and helping them to achieve economic self-sufficiency. As I said, all across our state, there are 34 nonprofit agencies. Each of them are different, but collectively, they all serve more than 100,000 individuals in North Carolina, and they all provide resources to ensure that individuals have access to a better quality of life. Most people know community action agencies for the Head Start programs that provide early childhood, and also for our weatherization programs that ensure that households are weatherized, that they're energy efficient, and that they're safe for individuals. Right there in Mecklenburg County, you probably know the Charlotte Area Fund, which is run by Mr. Nick Wharton and his dynamic team of individuals who operate that particular local community action agency.
And they do good work in the community. You're absolutely right. So now this organization, let's talk about the report and kind of tell us what's the purpose of it.
So Tanya, as I know, you have been someone who has been on the forefront of the whole issue of COVID. And as you know, there have been more than 1.4 million cases of COVID detected in the state of North Carolina. And unfortunately, over 18,000 individuals have lost their lives. Right there in Mecklenburg County with you, there have been over 150,000 cases and around 1,200 deaths. And so what the Community Action Agency wanted to do, we wanted to see what the impact of COVID has been on low-income and vulnerable communities all across our state. And so we commissioned a report with Dr. Jim Johnson of the Urban Investment Strategy Center at the Keenan Institute of Private Enterprise and the Cedar Grove Institute of Sustainable Communities out of Chapel Hill to study the impact of COVID on low-income constituents across our state.
And so let's talk about this report, starting with the lived experience or the lived experience of individuals. Kind of tell us what that's about and give some examples.
And that's what kind of makes this report so unique, is that you hear firsthand the lived experiences of those who were impacted by COVID. Oftentimes what we see are just the numbers, but not the faces and the lives behind those numbers. And this report is actually an example of that. And Tanya, in the report, you will hear stories of individuals who basically said, we've got to make do. We've got to figure out how to make $1 out of 15 cents. And that's
Right,
what they've
right.
done. Individuals who sold, unfortunately, their only means of transportation in order to pay their bills. Individuals who had to come up with another means of economic sufficiency in order to pay their bills. There's stories about individuals who realized their entrepreneurship side, families who figured out skills that they were really good at, and they took those skills and turned it into entrepreneurship or an economy that would help them pay their bills. And then there's also those unfortunate stories. There's one in there of a family who didn't have access to PPE supplies, and actually a family that utilized the same mask that unfortunately had the COVID virus. And as a result, members of the families caught COVID and of course were sick because of that. And so, go on, Tanya.
No, go ahead. I'm just, as you're talking, I'm thinking these are real people, real lives. I mean, this is your mom, your dad, your aunt, uncle, sister, brother. I mean, these are people putting a face to this pandemic.
And that's exactly what it did. Examples in there are also of moms and dads who became basically a school system because schools were shut down and kids had to learn remotely. Moms and dads serving not just as the teacher, but the janitor, the cafeteria worker, the counselor. They served as everything because, again, children were at home at that time, and most parents were working virtually, those who were fortunate enough to have a job that would allow them to work virtually. They were virtually at home. And so again, you hear those firsthand experiences of people talking about how to keep food on the table, how to keep bills paid. One of the things that the community action agencies all across the state were able to do was that we did something called a big pop-up.
Okay.
The big pop-up was basically a drive-through supply event in which we provided food, supplies such as PPE, and other resources that families needed. Community action agencies were also there to help people with rent and mortgage payments.
Congresswoman Adams was involved in that too, wasn't she?
That's right.
Yeah, I remember that. And you guys shut down the interstate. Yeah.
But there were also people like Representative Becky Carney and Representative Belk and Representative Carolyn Logan, who were also out there. And Tanya, that was 100-degree heat that day.
Yeah.
And those elected officials were out passing out supplies, doing what those of us who care about our constituency did to make sure that people had what they needed during the pandemic. And that's just one example of the many resources that community action agencies provided to families at the height of the pandemic.
So let's talk about the low income and the minority community, those that have been underserved. Did you guys discover anything that we haven't heard? Like the issue with, before some families had to decide whether food on my table or gas in my tank. But this time it's like they really didn't have a choice of either one because they didn't have anything.
And that's what's really unfortunate, or what has actually been really revealing about this pandemic, Tanya. Low income and marginalized communities are already living on the edge before a pandemic or a crisis like this. When something like this happens, it makes life even more devastating for those individuals. And again, this report talks about the hard choices that families who are low income and marginalized had to make about survival. But, as we know, that's oftentimes what we do in order to survive. And so you'll see numerous stories like that throughout the report of people making hard choices, but making those choices. And in my opinion, even though it also talks about the devastation, it also talks about the resiliency of people when they have to be resilient. If you're like me and you're a mom and you have a choice to make as far as feeding your children or taking care of your family, you will do what you have to do to make sure that gets done. And those are the kinds of stories that you will see in this report.
And if there's a silver lining, then that would be it. And as you were talking about the entrepreneurship, that's yet another opportunity. But let's talk about the pandemic. some people may be saying, why are we still talking about it? We're starting to turn the curve just a little bit. We thought here in Mecklenburg County they were going to lift the mask mandate, and we kind of had some false hope there because we dipped a little bit below the number that had been set, the percentage, but we then went back up a little bit. And I know that, again, we're heading into the holiday and we've got more people inside. So, what do you say to people that say, why are you talking about this still?
And that's exactly why we're highlighting this report, Tanya,
Mm-hmm.
is what you just said. We are going into the holiday season and we're going into the cold winter months.
Right.
And if you've seen that the price of fuel is going to, or is not going to, has increased as a result of supplier demand and the pandemic, you've seen the price of meat going up and food going up as a result of the pandemic, as well as resources being limited. And as you know, with economics, when something is limited, the price of it goes up.
Absolutely.
And so
supply and demand.
it is supply and demand.
Yeah.
And so that's one of the reasons why we are highlighting this report right now, because what we don't want to see is for people to forget that there are still those who are suffering in the midst of this pandemic. And the other piece of this, Tanya, is that right now the General Assembly, I think they've signed the budget, or in the process of signing the budget.
Yay.
As well as President Biden has passed his Build Back Better budget.
Right.
And so we want those officials who are in charge of budgeting and ensuring that funds are allocated to those in need. We want them to not forget that there are still those in need and those who need those additional dollars and resources. And so as we make those budgetary decisions, we want to ensure that information is at the forefront of the process as our elected officials, county commissioners, those who are in charge of budgets move forward.
Well, I appreciate you, Ms. Dunston, taking the time to share with us. She's with the North Carolina Community Action Association, and sharing about this report that we need to get the word out so more people are informed and aware of what's really happening. And it's not piecemeal together. This is an official report that's being presented, heavily researched, and comes from some reliable resources, which is what we like to pride ourselves in as well. So it's great to have you on here. So now tell us, what should people do? Like, what are you looking to happen when people read this report? What are next steps? Where do we go from here? You already said, the governor and, of course, the president. And don't forget about this. But let's bring it down a little bit more locally. And what should be happening now?
And Tanya, what I will say is that you also have county commissioners. Yes. You have others who are in charge of budgetary decisions. Again, we want them not to forget the least of these.
Right,
those who need access to those resources. And so we're calling on those individuals in those leadership roles to make the decisions that will help those individuals. And I will also say, Tanya, if your listeners are individuals of means and they can donate and give to a family or individual who is in need or in crisis, please do that. I would encourage them to visit our website, which is www.nccaa.net. Again, I say www.nccaa.net. And we have a giving fest going on right now. So if you're someone who wants to give and give to families who are in need, there's an opportunity right there for you to do that. But I don't
just about that. Where do you find these families? Like, can anybody apply or put in for it?
So again, as I said, there are 34 community action agencies all across the state. I would encourage those individuals to go to our website to find your local community action agency. And if you are in need, to please contact them to let them know that you have a need, that you need assistance. And they will ensure, first of all, you have to qualify for our services. But if you are qualified, then they will ensure that you get access to the services that you need.
So what's the website again? So, because I'm sure people viewing and listening, one of the things we push on here is share, because we put out some really great information. And so if someone's not able to watch right away, if they share and let them know that it's on, it stays on our Facebook page, but I also on my website, all of the episodes are posted there as well. So what's the website one more time?
So again, that's www.nccaa.net. www.nccaa.net.
So is this where they can find the report as well?
They can find the report. They can find a wealth of information about the services that community action agencies all across the state of North Carolina provide. And they can also find information about our Giving Fest if they choose to do so. But again, I would encourage them to start at our website, find your local community action agency, and then they can go from there.
So how do you keep people encouraged, especially those that you've met along the way while doing this report? And, sometimes it's just more than beyond difficult as people are dealing with the challenges. I mean, come on, whether it's healthcare, finances, or children, education, keeping the household going, trying to keep a roof over your head. What do you do? What do you say? How do you keep these guys encouraged?
And one of the things I will say that we do, Tanya, at the local level is we have case managers, we have leadership that does that at the local level throughout our state. We have some of the most caring individuals who head up these nonprofits, because again, I always think about people that do this work have a calling.
Right.
If this work is, if you don't have the stamina for this work, then you won't stay in it long. But the people who do this work have a calling, and they're called to do this and to help others. And so again, I encourage them to reach out to their local community action agencies, see if they qualify for services, and then apply for those services if they do.
And so we're going to wrap things up with you again, Ms. Dunston. Thank you so much for taking the time to talk with us. Is there anything else you would like to share in closing?
Again, I would love for folks to visit our website, but also find your local community action agency. Please read the report and share the report with others, and be an advocate and a champion for someone who needs you right now. People are really in desperate need as a result of this pandemic, and we've got to be our brother and our sister's keeper and make sure that we help each other as much as we can.
Well, you actually hit the nail on the head with that. But what's so important is that you've got a heart to serve, and we appreciate you serving our community and all that you've been able to do. And this report, again, getting it circulated, getting it in people's hands so they'll know what we're dealing with. And again, from reliable resources and great information as we move forward. We've worked really hard, but we've got more work to do. And I think everyone has to realize that. Thank you again for taking the time to talk with us.
Thank you for having me.
Absolutely. As we continue to keep you informed about what's happening in our community, just a couple of updates again, as you see scrolling across the bottom. We want to say thank you again to Ms. Dunston. She is with the North Carolina Community Action Association, and that report, they're working real hard to get it distributed. So please, again, share, encourage people to go to the website to find additional information. We're going to go ahead and move out of the way as we, on this Friday, want to make you aware that we'll start having more of these conversations, but we're kind of transitioning to something that's going to reach a broader audience. Next week, I guess I'm already putting it out there and claiming it, but next week, we're going to have recordings because it is the holidays. And then after that, transitioning to where we're working more with radio. And radio obviously reaches a larger, broader audience. And we've got more information about that. But speaking of radio, I am debuting tomorrow my first show on Praise 100.9 FM. I was at Praise back in 2005 to 2008 when it first hit the air. And I'm back on Praise 100.9 FM, kicking off at 10 a.m. I would appreciate it if you would tune in. Again, it's Sounds of Inspiration. Looking forward to what God has for me there, and looking forward to launching a program around canceling COVID as well. The management and staff has been amazing, and they like what's happening here. And we're just going to build on it. So we realize the pandemic's not over. And once we start making a lot of progress, there's still the whole lifestyle and healthy lifestyle change or life change that many of us will have to make, especially when it comes to things like giving up so much sugar, which is one of the things that I have to work on myself. I appreciate you all so much for all that you're doing, more than words can ever express. Thank you for continuously supporting Canceling COVID. Even with our faults and even with our challenges, you've been right there for us, and I'm grateful for that. As always, life's challenges make you better, not bitter. I'm Tanya Rivens. Have a great weekend, folks. Enjoy your Thanksgiving. Be safe. Please tune in tomorrow, again, 10 a.m., 100.9 FM. Thank you to our sponsors, Mecklenburg County Public Health, mecnc.gov. That's mecnc.gov. And thank you to Groundwater Solutions, Dr. Tracia Black. You guys have been amazing with all the work that you continuously do in our community. Have a great weekend, everyone, and thanks for tuning in.